Welcome to Demystifying Cannabis, a universal product taxonomy for informed choices. We're very lucky to have our speaker, Dr. Jokubas Zeberkas, with us today. He is a neuroscientist, and a lot of people call him Dr. Z for short. He's famous around these parts. Anyway, I've had the great pleasure of knowing Dr. Z for 8 years, 10 years, I don't know, a while. And I really appreciate him for many reasons. He has been an incredible advocate here, lending his expertise to our efforts at the state capitol to educate legislators. It's really nice to have people with some letters behind their names to give credence to what those of us who are grassroots activists are asking our legislators for. He is currently an assistant professor, associate professor, at the University of Houston. Dr. Z grew up in Lithuania, and he came to the United States for college, and he's been notably working in the area of epilepsy and also studies Alzheimer's. He is an expert in cannabinoids and cannabis, and has been really a pioneer in many ways in our space. Early on, he had a hemp CBD company called Florence that he and his wife, Incam, who is joining us today and will be speaking later at the conference, were able to sell several years ago. He's also been an executive with an MSO. He is a driving force of innovation at the University of Houston and works with entrepreneurs that have innovative ideas to help them get those ideas to market and to ensure that they have the proper scientific research and background to support those innovations. He is a true entrepreneur as much as he is an educator. I have heard through the grapevine that his class at the University of Houston is one of the most popular, and that there's often waiting lists to get to be in this class. Currently, he has two really interesting companies that he and Incam are working on. Collectively, they're co-founders of Uniwise and Addendocs. Did I say that correctly? Great. So he has over 25 publications and many prestigious awards. And I encourage you to read his bio in your program here. Please join me in welcoming Dr. Jokubas Zeberkas to the stage. From hand.
Thank you very much. Oh, you can help me out? Okay, excellent.
It's a bit of a step. You can do it with a walk.
All right, I'm going to take one of these. So thank you very much. It's a real pleasure to be here. Thank you, the organizers, especially Heather Fazio, for inviting me to talk here. I was here 2 years ago and I spoke of a different subject. I spoke of the Texas Compassionate Use Program. And we had many hopes for that program 2 years ago. And some things changed in the state about 2 years ago too, that we'll talk about, that essentially prevented the medical cannabis and broader cannabis programs in Texas from forming. And I will discuss that today in my talk briefly. I also want to say that it's an honor to try to follow and act by one of the powerhouses in cannabis, Dr. Ethan Russo, whose work I've been following since I became interested in cannabis in the late 1900s. 1990s. Okay. So, and as I became interested, I started teaching the endocannabinoid system and cannabis, cannabinoids, interactions with the endocannabinoid system. And I became involved in private ventures and startups about 10 years ago in 2014. And so as Nisha said, I am an associate professor, which tells you that I have gotten a tenure, and that's very difficult. It's very difficult. We can talk about it some other day. I'm also co-founder of these two companies, and what I will say today is purely my and my company's opinion, and what I'm broadcasting is purely mine, has nothing to do with the University of Houston. So I want to just put that up front. And let's talk about cannabis some more. I prepared the slide maybe 10 years ago. And when I prepared the slide, we had a problem. We had a problem in the fact that we had synthetic cannabinoids on the market. So this is some of the basic things as we understand hemp, which became legalized essentially through hemp farm bill, up to 0.3% delta 9 THC, which is really all THC, delta 9 THCA also. And this limit is set by regulators. So in Europe, in some countries, it's 0.2 delta 9 THC. In other countries like Italy, it's 0.6. Switzerland is 1%. This limit is arbitrary. It's just really by scientists and regulators. Now, we also have cannabis that we call marijuana, which produces the same delta 9 THC, delta 9 THCA, typically 25% what's on the market. And cannabis plant cannot produce more than 33 to 36% of cannabinoids, because otherwise it cannot live. It has to make other things, synthesize other things. You saw that in Dr. Ethan Russo's talk just a few minutes ago. And I made the slide and I talked about this a lot to my students. I talked about synthetic cannabinoids and dangers of synthetic cannabinoids. And that was spice and kush. That was spice and kush in all of the head shops. And the regulators couldn't chase it. Over 70 variants that were coming from Eastern Europe and Asia. And it was a problem. People could go into the head shop and buy these synthetic cannabinoids and get high. And there was no COAs that told you the amounts of these cannabinoids, and they became available on the streets, and people were peddling synthetic cannabinoids on the streets. And at some point, 2017 or 18, there were over two dozen deaths in Herman Park from the synthetic cannabinoids. And strangely enough, I come back to the slides 10 years later and I tell my students that now we have other types of synthetic cannabinoids that fall under hemp-derived, and they're delta 8, delta 10, THCP, HHC, all of the cannabinoids that are not in the plant. So they're synthetic. And now I warn my students that take my course, lucky enough, it is sold out every semester. When they take my course, I warn them about this and I explain to them exactly what delta 8 is, what delta 10 is. And so I actually starting to group some of these cannabinoids into that image right here and can add them onto the list of spice and kush and others. Cannabinoids are made by these beautiful translucent trichomes that Dr. Ethan Russo just was describing. Terpenes are also mostly made in these beautiful trichomes. The major biosynthetic pathways in cannabis are cannabinoids, monoterpenes, sesqui and triterpenes, lignans, and flavonoids. And of course, for cannabinoids, the biosynthesis is for acidic cannabinoids in cannabis plants, so CBGA, CBCA, THCA, CBDA, and THCVA. And what's important is, again, these cannabinoids are typically over 22 carbon long chains, so we cannot smell cannabinoids, but we can smell terpenes, especially monoterpenes. So what you saw in the previous talk is that monoterpenes have the shortest carbon chains, 6 to 10, and then you have sesquiterpenes, and those become longer carbon chains, 15 carbons. And in fact, there is terpenes that we smell, monoterpenes and sesquiterpenes, but everything above 16 carbon chains we cannot smell. So there's a lot of terpenes, triterpenes that we do not smell. We do not perceive that. We do not have a mechanism to perceive these long carbon chains, the scent of these long carbon chains. Just like with cannabinoids, we cannot do that. There's a whole biosynthetic machinery that's really beautiful in the production and the whole cellular arrangement in the trichomes in the production of the enzymes, synthases, in particular, in these trichomes that synthesize acidic cannabinoids and also terpenes and cannabinoid intermediaries and pre-synthases. And the major cannabinoids that we talk about in cannabis, because of their prevalency and also their prevalency in the market, is CBDA, CBGA, and THCA. So when you have a raw plant or a trichome from the plant, and if you consume that through cold ingestion, let's say, that trichome will not contain any delta-9 THC. It will actually just contain delta-9 THCA. And for it to become CBD or CBG or THC, the neutral versions of it, they have to undergo the process of decarboxylation, which is typically through heating processes. And as was pointed out, the two medications on the market that are, one of them is plant-derived, and when I say on the market in the United States, because sativa, the second plant-derived medication, is still not available in the United States. And in fact, Epidiolex, interestingly enough, just failed stage 3 clinical trials in Japan for the same conditions for which Epidiolex is being prescribed here in the United States. Dravet syndrome, Lennox-Gastaut. So it's an interesting story, even with approved drugs and how they may vary across different geo-locations in this case. But we have plant-derived 10% CBD medication, which is Epidiolex. It's a mixture in sesame seed oil with some alcohol and flavorants, I believe strawberry flavorants. So from the formulation perspective, this is really rudimentary CBD isolate diluted in oil, because CBD isolate is oil soluble. It's not water soluble unless you do certain things to it. So it's very simple preparation. And we also know that things from oil don't get into the body as well as they could be if they were nanoparticularized and prepared with things like cyclodextrin and other potential lipophilic particles that have been nanoparticularized. Okay, so this is pretty primitive formulation at 10% CBD. Now, synthetic delta-9 THC tablets have been on the market since the 80s. And the story here is interesting because this is the pharma drug, but the pharmaceutical companies always watch what's happening in the society and in science. And so in the 70s with AIDS and HIV, especially on the West Coast, there were a lot of individuals that were undergoing wasting syndrome. They were losing weight, they had massive nausea and vomiting. And this was for AIDS patients as well as chemo and cancer patients. And so the local growers started supplying them with strains, with extracts, and lo and behold, they saw that it helps nausea, it helps vomiting, and it helps with pain. And so just 10, 15 years later, pharma had the synthetic version of delta-9 THC in a tablet. And pretty rudimentary, just a dry tablet that gets basically eaten or delivered through ingestion. So these are the major acidic cannabinoids that turn into neutral cannabinoids. And if we consume delta-9 THC, the other thing that happens, our own bodies produce secondary metabolites on these cannabinoids. So secondary metabolite 11-O-THC is also psychotropic and intoxicating. And it's actually higher level of intoxication through the metabolite of delta-9 THC as compared to THC itself. This is CBDA, which is also the acidic version, and these are the delta-8 and delta-10, which I put in red because they're synthetic cannabinoids. And you have a shift of the double bond here between carbon 8 and 9, and also between 10 and 11 for delta 10. Now, it's important to know that these cannabinoids have different actions on our bodies. We have the endocannabinoid system, one of the major receptors of this endocannabinoid system in our bodies and the brains and everywhere in the body, CB1 receptor, cannabinoid receptor 1. We have endocannabinoid system that's very extensive throughout the body, and I have another slide on this. But the point of this slide is that the three major phytocannabinoids that we're talking about, CBDA, CBGA, and THCA, once they get converted into their neutral versions, and even if they're not converted into their neutral versions, let's say they stay in acidic format, they have different interactions within the cannabinoid system. And here I'm just highlighting one target receptor, CB1 receptor, where CBG is an antagonist, CBD is negative allosteric modulator, and delta-9 THC is an agonist to CB1 receptor. Agonist means it activates activity of CB1, antagonist inhibits activity of CB1 receptor. Negative allosteric modulator means it falls somewhere in between and mostly reducing the activity of CB1 receptor. So this is pretty complex. And as you heard earlier, we have dozens of these cannabinoids, phytocannabinoids in the plant that we still don't really understand either their basic mechanisms of action at the level of a single receptor target or other receptor and system targets that we have in our body. And we don't even understand their therapeutic properties. And even more so, the combinations with other cannabinoids, the entourage effect properties that they could have. And that is because the cannabinoids and endocannabinoids, the endocannabinoids are naturally produced by our bodies. The two major ones are anandamide and 2-AG. And they interact with the cannabinoid receptors, CB1 and CB2. And these receptors, as is illustrated here, these receptors are dominating different organs. So for example, CB2 receptor is mostly involved in the inflammatory and immune response in the brain and the body. And it would be found in high levels of expression in organs like spleen, but other CB1 receptor will have high expression in the digestive system, high expression in the heart, higher than CB2, as well as in the brain. The CB1 will be dominating in the brain. It doesn't mean that CB2 is not there. So all of these cannabinoids will be interacting, the endocannabinoids will be interacting with CB receptors, but so will be the phytocannabinoids. These molecules are sort of like keys that you can fit into a lock. And the lock is the receptor, the CB1 receptor. So if the structure of the key is similar and it can bind to the same target, it can exert similar activity essentially to the endogenous produced by our body, cannabinoids. And the endocannabinoid system serves many different functions: immune, stress response, appetite, memory, inflammation, thermoregulation. It gets increased endocannabinoid levels with the production of human milk to encourage the suckling shortly after birth. And these are essentially the signatures of a system that is a major homeostatic regulatory body system. By homeostatic or homeostasis, we mean that everything is somewhat in a dynamic range in our brains and bodies. Like our body temperature, if we took everybody's temperature right now, it would be about 37 degrees centigrade. There might be a variation of 36.6, 37 to 5.5 will be all about physiological body temperature. And we know what happens if you go outside that normal physiological body temperature range. So let's say you have a fever and in Fahrenheit, let's say it goes to 104, 105 degrees. You have an emergency situation. You have to regulate the temperature, thermoregulation. You have to regulate the molecules, the chemicals, the behavior of the body in order to reduce the temperature. And if that doesn't work, then you have to put yourself in an ice cold bath, take medications, and so on. So this is what homeostasis is maintaining that dynamic operational range and constantly rebuilding it if it goes outside the bounds on the upper or the lower ends of this dynamic range. And that's what the endocannabinoid system does. And when we talk about the endocannabinoid system in the brain and we just say CB1 receptor, it's a lot more complicated. This is actually a pretty simple diagram. It only includes CB1, CB2 receptor, some ion channels, and some other transmembrane proteins and cellular targets. This is mostly the acidic cannabinoids, the actions of THCA in particular, that will be either stimulating CB1 receptors on neurons or stimulating CB1 and CB2 receptors on glia. And again, both cell subtypes are the major cell subtypes in the brain, neuronal cell subtypes and glial cell subtypes. And glia is also intricately involved in maintaining this dynamic homeostatic range of activity in the brain. And you can see that overall, the acidic cannabinoids, again, as pointed out, they target CB receptors, but they also have other targets. They have targets even on beta amyloid plaques and serving a function of neuroprotection. So a lot of the cannabinoids where you see a leaf here will have an effect on these cellular targets. It will regulate the amount of GABA and glutamate. GABA is the major inhibitory, and glutamate is the major excitatory neurotransmitter. So the CB receptors are positioned in the synapses where when you activate CB1 receptors, they can regulate the amount and typically reduce the amount of both glutamate and GABA. In fact, when the endocannabinoids were first discovered in CB1 receptors, it was discovered in the inhibitory system. So we thought for many years that endocannabinoids and CB1 activation was regulating the release of GABA. But later we saw that it's also regulating the release of glutamate. And by regulating the amount of glutamate, it can prevent what we call glutamate excitotoxicity, where the amount of glutamate and excitation in the brain becomes toxic. So it's pretty complicated. And once again, this is just two model neurons in the glial cell that is a part of this major, what we call trisynaptic circuit in the brain. But the targets are abundant. It's not just CB receptors, it's other transmembrane proteins, it's transcription factors, nuclear receptors, and inflammatory regulators such as COX molecules. CB1 receptors, again, let's go back to just one receptor. And if we look at just one receptor, we realize that it's expressed everywhere in the brain. And there are different levels of expression of CB1 receptors in different parts of the brain. And different parts of the brain are responsible for different functions. So if our occipital lobe in the back is responsible for vision, our temporal lobe on the side is responsible for hearing, our prefrontal lobe in the front is responsible for cognitive and executive functions. Okay? So by activating these CB1 receptors in various locales around the brain can influence different behavior and different physiology and eventually the output in the brain. So cannabinoids, major cannabinoids, they're targets, and the complexity of even just one receptor, how it interacts with multiple phytocannabinoids, or how that one receptor can influence activity in multiple brain regions. We also have terpenes, as we discussed, and that's where the aromas for terpenes come from, and that's where some of the names for the strains, cannabis strains, come from, such as skunk, because it smells skunky, or lemon haze, because it smells like lemon. But these odorant molecules, the ones that we perceive as smell, also change the physiology of our brain. So when we think of the sensory stimuli, the sound, the smell, a lot of times we think that this is something that's happening around us subconsciously. Oh, there's some music playing in the background. But that is not true. All of the sensory information shapes our behavior. The smells shape our behavior. You can be attracted to somebody or something because of the smell. You can run away because of the smell too. So eventually the way these molecules work, the odorant molecules like terpenes, is not by simply It's a banana smell. It's actually activating different parts of the brain. This is done with functional magnetic resonance imaging. And it's not only the olfactory centers which are located in the front of the brain that get activated, but in fact, these olfactory centers are very strongly interconnected with the emotional centers of the brain. It's called the limbic system, with the memory centers of the brain. And that's why smelling pancakes can bring back a story of your grandmother in the kitchen and what she was wearing and how you felt that morning with her pancakes and so on. So this is a change in the physiology or the function of the brain, which means that your behavior and the physiology of the body is also changing. It's not just something that we just process and it doesn't influence how we behave or how our body acts, actually. The major terpenes, I don't think I have to review it, which was done just a few minutes ago. Limonene, myrcene, pinene, and linalool. I think I would agree maybe with Ethan that alpha pinene is one of my favorites. And because it is an acetylcholinesterase inhibitor, and acetylcholinesterase inhibitors are medications for Alzheimer's disease. So when you hear commercials on TV, are you on SINS, which is cholinesterase inhibitor, CIN, that's what it gets abbreviated to. So most of the Alzheimer's medications on the market are SINs. And they're ineffective at stopping the disease. They're only effective at slowing down the progression of Alzheimer's by about 20%. So an effective drug on the market for Alzheimer's disease has to slow down the progression of that disease, the severity of that disease progression by about 20%. The latest one slows it down by about 30%. This is a huge opportunity, I think, beyond the forest bathing and the smells. I think this is a huge opportunity to start studying the effects of pinene and potentially for dementia and for memory loss. Medicinal properties of terpenes are emerging. So there's new literature coming out as we speak all of the time. And also, let's not forget that these terpenes are not unique to cannabis at all. So the closest relative of cannabis is hops. And hops are also loaded with these terpenes that you find in cannabis. This is an ongoing emergent field, and we're trying to make sense of it. And how you're trying to make sense of it is that we need some sort of systems that help us understand what are the monoterpenes, what are the sesquiterpenes. Can we actually start saying that monoterpenes help with certain conditions because of their structure or a set of conditions? And sesquiterpenes or triterpenes might be helping with other sets of conditions because of their structures. So there's a number of articles that came out in the last few years. And this is the first article that tries to basically organize the system of terpenes, hemi, mono, ses, poly, sesquiterpenes, triterpenes, into what their roles might be. I think this is an oversimplification. I think this diagram should be really, really complicated, just like cellular mechanisms of action by Sigma Aldrich poster. It has like 200 targets and 5,000 interconnected lines. It's probably a lot more complicated than this. But this is a first attempt to kind of try to group all of the terpenes. It's not just cannabis terpenes, all of the terpenes into potentially targeting specific groups of conditions. And I like that because it's an attempt at solving this puzzle. And of course, what we've learned in the last few years, it's also molecules that are non-terpenes that actually give a lot of impressions of how we perceive cannabis. So exotic cannabis typically refers to cannabis that smells, has very strong floral smells, or the opposite, very strong gaseous smells, kind of a rare. Doesn't smell like grass, basically. It smells like something exotic, something else. And so what we now know is that we have this division of the secondary metabolites of cannabis, from cannabis into cannabinoids, into terpenes, and into other flavorants. And some of the most exciting science in the last few years has been these volatile sulfur compounds. They're found in very low concentrations, and there are at least 3 types of these compounds that are emerging, the prenulated VSCs, and they're associated with the skunky gas-like odors of cannabis. Then you have tropical VSCs, it's just called tropical VSCs, a major citrus or tropical fruit aroma. And then you have this catole, which is highly pungent, and it is more like savory, borderline savory chemical smell in the varieties. And so what was interesting is there are studies that have been done that have asked for participants to identify different strains of cannabis. And if those strains had the same terpenes in them, the subjects identified the difference in cannabis based on VSCs and not on the terpenes, because the terpenes are the same. So this plays now an important role, is not only in perceiving the cannabis, but in potentially the commercial aspects and what is being perceived by humans and by patients. Despite all of this huge knowledge on cannabinoids, on the endocannabinoid system, and it is fairly new knowledge. So the endocannabinoid system was discovered in the 90s. So we're looking at 30 years, and sometimes humanity moves slow on certain things. But despite all this, we only have 2 plant-based medications, and only one of them, Epidiolex, that we have in the United States. And that's an oral solution that is anticonvulsant. That's for pediatric epilepsy. And that's it. So there's no other FDA-approved cannabis medications except for synthetic delta-9 and plant-derived Epidiolex. And that's it. So when scientists, and especially Dr. Ethan Russo, who has an incredible amount of knowledge and experience in this field, says that there is still a lot of work to do. There's a lot of work to do, and there's a lot of opportunity with phytocannabinoids that we don't know, we don't understand. Around the world, this opportunity exists everywhere. So United States, we're not in a vacuum. Thailand is legalizing medical cannabis. Germany has now recreational cannabis. Germany is about to approve the law of growing cannabis at home. So there are national programs. There are national programs that are subsidized with insurance. In Canada, veterans get subsidized up to, I believe, 4 or 5 grams of cannabis a day. In the United States, as we know, we have medical cannabis programs, recreational cannabis programs. We have the coexistence of both. Sometimes people say, well, what's the difference? I often use the example of Massachusetts. You can buy cannabis for recreational needs, or you can buy it as a medical cannabis patient. And the only difference is a 20% tax. So if you're a medical cannabis patient, that's a 20% tax that you're saving. I think that's not good enough. If we're treating this as a medicinal preparation, we should start looking into some sort of a insurance subsidies, especially for patients that need to use high dosages in a lot of these preparations. If we look at the state-regulated cannabis by the National Conference of State Legislatures, this map keeps changing all the time. So it's outdated now, and it's only a couple of years ago. And it's also outdated for another reason. 2 years ago, we talked about medical cannabis, recreational cannabis, and hemp CBD program. And so this map was fitting to that. But now we have medical cannabis, recreational. We have unregulated hemp derived cannabinoid markets in some states. In some states, we have regulated hemp-derived synthetic cannabinoid markets, and we have regulated phytocannabinoid markets, mostly in all of the states too, from hemp. So this map, I think, has to be updated and actually needs to start talking about the abundance of hemp-derived cannabinoids and where they're legal and where they're illegal. And the confusion persists. The confusion persists for everybody and especially for consumers. So a lot of us here, we understand cannabis. We want to learn more about cannabis from different angles. Some of us have more expertise in legal fields, others in business, others in science. But we're here trying to understand it. The consumers quite often don't have that ability. They don't understand the difference between THCV and THC. They don't understand the difference between Delta 8 and Delta 9 THC, especially if the person behind the counter is telling them it's naturally occurring Delta 8 THC. The plant synthesizes Delta 8 THC. And so you believe that person and you buy that product. But in reality, for consumers, it's extremely confusing. There's lack of science and research on the products. If you recall, a few years ago, the state of Texas allowed Institutional Review Board to approve the study of cannabis, marijuana, through the producers here in Texas. But nobody has tried that pathway, the Institutional Review Board pathway, to study the cannabis in the dispensaries in Texas. It hasn't been done, and years have passed, and billions of dollars in sales have been generated from hemp-derived products. Market was over $2 billion in Texas last year from hemp-derived products. And the hemp-derived product producers will tell you everything. This helps you from sleep. This is pain. There's no validation for any of these statements. That's the problem. It's all anecdotal. And quite often when you're hearing this information from somebody that is maybe getting paid minimal wage behind that counter and getting the discounts on the products they're selling. So it is questionable. There's no standards. There's no standards for labeling. There's no standards for indicating what is in the product. There's no standards often for testing. And when there is a standard for testing, the COAs can vary from two different labs, 20% THC versus 25% THC. Which one is it? So there is no standard, and this, of course, the standards are being established. But this is the phytocannabinoid, is Delta 9. This is the phytocannabinoid, CBD. And this is the what I call semi and synthetic cannabinoids, Delta 8, Delta 10, HHC, and THCP. And if you don't believe me that Delta 8 is not natural, that the plant doesn't produce it, the first thing you have to ask, is there a synthase for Delta 8 THC in the plant? And the answer is no. The plant doesn't make Delta 8. So where does this thing come? Oh, it's in trace amounts. Who said that? 1960s. Raphael Mechoulam said that. Sure, trace amounts. Why is it in trace amounts, Delta 8? Because cannabis has Delta 9, and through isomerization, you heard the story of CBN. It's not a phytocannabinoid, it's old weed. THC turned into CBN, and it's being sold as a sleep aid with almost no proof that it works as a sleep aid. So here you have Delta 8 now, okay? Delta 8 becomes Delta 8 because Delta 9, there's some isomerization that happens from Delta 9 THC and Delta 8. And most of the studies that are done with gas chromatography, which uses heat to study the elements, will find trace amounts of Delta 8 in that sample. And I've challenged everybody on LinkedIn and all of my colleagues, and I said, cold-pressed rosin, cold-pressed preparation, HPLC cold tested. Any Delta 8? No Delta 8. Any Delta 8? No Delta 8. Never seen it. Never seen it. Lab directors. No, never seen it from cold preparation. So that tells you it is a conversion product. Okay? And so we have to know that. And it's not occurring in hemp if the hemp is allowed to have 0.3% Delta 9 THC. Therefore, you cannot have 25% Delta 8. in that hemp product. So let's just be honest, as scientists, we're honest, but as producers and makers of these products, let's just be honest that these are synthetically synthesized products, and I think that it's time to start labeling them. Multiple patents have been issued by Raphael Mechoulam also from the 60s and all the way to 2002 of conversion of CBD to Delta 8, Delta 9, Delta 10 also, and other cannabinoids. And so this is, I think, a little bit of a history that we've all experienced. And the history is that hemp CBD became legal. Everybody started growing hemp. There was a lot of CBD produced. Soon enough, it was a realization you only need one field in the United States to supply everybody that needs CBD with CBD. So what are we going to do with these 50-gallon buckets of CBD oil and isolate that are standing here now, about to expire 2 years later? We're going to turn that into Delta 8 because that is what's going to sell. And that's exactly what happened. And sometimes when you go to the shops here and you get a product, there's thousands of shops that sell Delta 9 THCA products. I went into a couple of shops and I got the products. First of all, it's extremely confusing what's on the label. Second of all, in some of these products, there are no phytocannabinoids at all. And in fact, I went in one location to ask, I would like to buy Delta 9 THC, and I bought Delta 9 THC. But when I looked at the COA and when I sent it out for testing, there was no Delta 9 THC in that product. Okay? And that's a problem. Okay? You want to buy vodka or beer? You want to buy vodka in a beer can and chug it? I don't know. So to solve this problem, we need a cannabis product taxonomy. We talked about cannabis plant taxonomy. In the very early days, it was sativa, indica, hybrids, ruderalis, based on morphology of the plant. Simply the appearance of the plant and levels of THC, typically. Sativa plants having slightly less if they were grown as hemp historically. Now we have these type 6, although they're somewhat shifting and some people name them differently, especially the type 5 and type 6. This is based on the chemovar. Chemovar is the chemical output from these strains and from the plants. But we don't just have strains, we don't just have plants. We have thousands of products, tinctures, gummies, vapes, concentrates mixed with flower. And which type are they then? When you take a CBD dominant chemovar, mix it with THCV or some other CBG dominant, now you have a product which doesn't represent any type of strain, if you may. So for cannabis product taxonomy, there's been several attempts that have been done. First of all, this is the flower strain system by Leafly, and it's pretty complicated. The diamonds are THC and the circles are CBD, and the colors are the dominant terpenes. And when I first looked at this about 6 years ago, I said, this is pretty complicated, and I challenged the audiences in Europe at the time and in Prague and in Lithuania to come up with their own system for representing cannabis products. I said, this is too complicated. Then there's the representation of terpenes in the color. And you saw another representation showed to you by Dr. Ethan Russo, the phytofacts. It's a lot of color also, many different colors. And there's a radio chart. And that radio chart is telling you an effect. And that effect is based on somebody reporting something. It's not a study, right? It's a questionnaire. The strain made you, yeah, so now we have a radio chart and it's based on ingredients and it's an effect. But we all know that we have individualized endocannabinoid systems. We have individualized responses to the same molecule a lot of times. So the effect potential is not the best way to produce this taxonomy that's based on the fact. Now, there's a ASTM, which is the standardization body international, and it produced this symbol in 2 years of work for cannabis. Takes a long time. They've done a lot of good work in the SOP, sensitization and extraction processes in cannabis, but in as far as some sort of a harmonized or unified labeling representation system for the whole world, we have one symbol in a yellow triangle here. So when 6 years ago, I asked everybody to make their drawings and present their cannabis in different systems, I came up with an idea, and then with my co-founder, Inka, we started developing this idea about 4 years ago, very intently, into a system. Now notice that Leafly, you cannot use Leafly system as a user, as a producer. It belongs to Leafly. Leafly will take that information, will give you the symbol. You cannot use this system of terpene wheels. It belongs, it's proprietary. There was no technology that's built around it. And so we decided, hopefully this works, to build the technology for it. And I'd like to show you a video, hopefully. Wait a second. There it is, and hopefully it will play. So the power of AI video.
Exposing the secret in cannabis innovation. Ready to see how tech is transforming information about all cannabis products? Imagine this. Your customer is in a dispensary looking for the perfect product, but gets completely confused by the labels. But how do they know which one suits their needs? Everything seems so subjective and based on specific effects. Enter our business-to-business software UniWise. This cutting-edge technology categorizes and scores cannabis products based on their active ingredients, providing clear and objective information to the consumer based on science. Okay, I'm interested. So how does it work? UniWise's patented system analyzes the certificate of analysis, or COA, of each product and produces a visual representation and product strength score based on the active ingredients. So no more relying on strain, brand names, or other unverified marketing claims. All a consumer needs to remember is their unique UniWise wheel and product strength score by scanning a QR code, making their shopping experience more uniform and consistent. Cannabis platforms aiming to enhance their services and boost revenue should connect with us at uniwise.com to integrate UniWise into their network. Partner with us today. The future of cannabis is here, and it's smarter than ever. Next time you're shopping, let UniWise guide you and visualize UniWise today. Elevate.
So you have to market your ideas. I'm learning that you have to market your ideas. So this is our attempt at trying to introduce this. Actually, this is the first time that I talk about this system to the extent that I do in this meeting. And we did something different. We said we don't want an effect because the effect is arbitrary. So we don't want to do all of the science and analysis just by surveys and then say that this actually around the world will apply to everybody. And the first thing that we saw is there is no system that one can interact with. There's no technology. Terpene wheel is not technology. Leafly is not technology. So we build a technology. But we build a technology that's applicable to all cannabis products, not strains, not terpenes, products in that particular, ingredients in that particular product. And we said, we're going to do something a little bit arbitrary, but we hope that eventually everybody is going to agree. Some products are light, some are moderate, some are strong, some are extra strong. Have you ever seen that kind of a categorization of cannabis products? I have seen it only in Quebec, in Ontario. And so when the consumer comes, they can actually say, I want my moderate cannabis. And that moderate cannabis will fall within a certain range of concentrations. This system is applicable not only for flower, but for all products. I'm just demonstrating the flower now, but if anybody wants to talk to us about this, because this pitch is to try to collaborate first with local Texas businesses. This is B2B software technology. that is patented technology. So the algorithms and the system is patented. It's based on active ingredients, and there's no subjective recommendations. Let's look at some example of how this system busts the myths or the mythology, in this case, the mythology of Blue Dream. You're looking at 2 COAs, one Blue Dream from Colorado, one Blue Dream from California. They have about the same composition of cannabinoids. They have similar but not the same composition of terpenes. Is it the same product? Are these two different products? In fact, our system says one of them is strong in as far as intoxication level, which is indicated in the dark circle here, the level of intoxication, and the intoxicating cannabinoids are indicated in dark. So the consumer here would say, you know what, instead of looking for extra strong product with pinene, when I go from Colorado to California, I'm going to look for strong linalool product, and that's going to be close to Blue Dream or whatever it may be called. The same strain, the same genetically so-called stabilized seed will not produce the same chemical output, and you will not find the same chemical composition in the same name product, the same strain, the same seed across the world. It will all be different. And so it's deceiving for the consumer to think that they're getting the same product just because it's called the same. Now, this is another example of Texas hemp THCA flower and California marijuana COA. Uniwise doesn't lie. This is as intoxicating as any marijuana you'll find anywhere in the world. It doesn't lie. And it tells the consumer that's what it is, and that's what you're buying. So this is not a story of hemp THCA that has nothing to do with marijuana. It's the same thing that will have intoxicating effect, as strong of an intoxicating effect. So a little bit of a sales pitch, where this is the Leafly system. It's a simple visual, right? It's not a simple visual. So this is Leafly's representation. This is not a simple visual. And it's very difficult to remember the colors and the diamonds. So now let's look at categorization by strength. None of these competitor systems have categorization by strength. Nobody has assigned it, and our categories change because for concentrates, 20% is actually light, but for flower, 20% is strong. And that is because concentrates go from, you name it, 30 to 100% strength. And so we have to categorize these. You have ingredient score, and you may have noticed that we actually have an ingredient score that is both a combination of cannabinoid score and terpene score. How does that happen? This is a wine spectator without the spectator. This is the wine spectator based on active ingredients, known biological properties of these actual ingredients, and the ability for this algorithm to tune into the AI and the ongoing science to actually change the values of the score as the ongoing science and discoveries in clinics are taking place. So it's a dynamically linked score that can be linked to the changes of the value of these active ingredients as we do new science, as there's new clinical research emerging. So we think we build a system that has simple visual representation. It's just one wheel. It's linked to QR codes. So if you want to draw all of the information, all of the cannabinoids, all of the terpenes, it's still there. But if you just want to remember who you are for the day, for the week, for the month, for the year, you can do that easily. We have a categorization by strength. So we're trying to guide the consumer and saying, look, this is strong, or this is light, but somebody will say, this is arbitrary. Light for somebody can be really strong, but hey, how can you categorize alcohol? You can. There's a beer aisle, wine aisle, and there's vodka aisle. And you don't want to buy beer in the vodka aisle and vice versa, right? So you have ingredient score that is based on the actual ingredients in that COA. You have applicable to all formats, meaning that Leafly system is for strains, terpene wheels is for terpenes. Phytofacts is for strains. This is for all of the products, So tinctures, including edibles and so on. So I hope what you have learned in this talk, and I give this talk with some learning objectives. Typically, I'm a professor, so I can do it. So the understanding of the complexity of the cannabis plant. And thank you to my dear colleague, Ethan Russo, who has explained this much better than I did. But I hope I introduced you to some interesting concepts here too, especially how different molecules interact with different receptors and how there's massive distribution of these receptors throughout the brain and the body. That we have challenges in the current cannabis market. We have to recognize these challenges, we have to solve them. To ban everything is not a solution. To label everything properly so the consumer knows, it's fine. To have regulator know what the consumer is consuming, normal thing to do. Right? But to make profit on something that is naturally occurring, that you're pushing delta 8, delta 10 with falsified COAs, that doesn't help the consumer. It doesn't help the industry either. It halts the legalization of medical cannabis and decriminalization of cannabis in Texas as a whole. And that's why, in part, teacup has slowed down in its growth significantly. Because people didn't want to get their products with a markup through a doctor when they can get it in the dispensary, and there's now 50 of them within 5-mile radius from where you live. So open 24 hours a day. So what medical cannabis program are you talking about? How are you gonna change this? So we have to change this. And I think the change is through transparency. It's communicating transparently what you are producing, what you are selling. And finally, appreciation for the need for standardized cannabis practices and labels on the products. Uniwise is just a solution. Just like there is wine spectator, wine enthusiast, and there's some other wine rating system. And I'm not saying that Uniwise is a be-all, solve-it-all, but it's an attempt, and it's the first attempt to categorize and to put a taxonomy across all of the cannabis products. So I hope you've learned something today, and if you have any more questions, I'm happy to answer questions, or if you'd like to talk to my co-founder, Inkem, about how to integrate or how to work with us with Uniwise, we're more than open for discussions. Thank you. So the score of the product based on the active ingredients, so it can be a strong product, but if it has only one cannabinoid, it will have a lesser score than a product that has multiple cannabinoids, including minor cannabinoids that have biological properties. That score, we call it electronic ingredient score or entourage score, either way you want to call it. But the score is the difference. The other argument that I will make is when I go buy wine, I typically buy wine between 12 to 14.5%. And there is wine that is 6%, but I'm not interested. And then I know plenty of people that love sweet wine at 6 to 8%. And you know, if you're at a Nigerian party, that's what people are going to be drinking, something that is lighter in alcohol and sweeter. And that is how it will help the consumers. And this is the score is what gives an ability. So when you have a product that has 30% THC sitting on the shelf, and that's the only product that's selling all the time, and the one next to it is 25%, and you can't sell that product. And you know it's a better product. You know it's a better quality. You know it has at least 6 different types of cannabinoids and a number of terpenes. You cannot smell it because the consumer looks at that 30%. I'll take that. So our score fixes it. That 30% may have a score of 4, and the 25% may have a score of 5. And this is where the consumer is like, well, how come this is? Because this is actually more noble ingredient product compared to the one next to it. And as far as jars, one more thing. Most of the places that sell deli style in jars, so you look at the jar, you smell it and then weigh it out. The jars will just have names. And so next week you walk in and you look for a name and that name is not there. So what do? And in our system, if you go to our website, we have an image of where you take those jars. So now you put the visual identifier on those jars. And so if your name is not there a week from now, you actually have two similar visual identified strains that you can rely on for that particular week. Yeah.
I have two questions. One is, your slides are fantastic. Where'd you get them?
I think it comes with the territory of being a professor for 18 years, made it myself, and also rely on references.
I'm a THC prescriber. How do you see this really solving the problem of the billion stores around? I mean, people are going to go in there and actually go, oh, it's not what I had. Or somebody knows what they're talking about.
So this system, like in any technology system, is something that we keep improving. And one of the things that we're working on right now is when you get the visual representation, if it has a synthetic delta 8 or delta 10 THC or HHC cannabinoid in it, it will have a S for synthetic marker. And so this is not a solution to the problem, but this is a way of trying to let the consumer think this is phyto and this has S. What's S? And then if the producers or if the stores actually adopt that system and they are willing to put that S on it, they'll have to tell the consumer this is synthetic. So what do you mean it's synthetic? What about this? This is not synthetic. So the system doesn't lie, as I said, and the minute the active ingredient from COA is a synthetic cannabinoid, it will put that essentially red flag on there. The consumer can still buy it. You know, just like consumer can still buy firewater if they want to in an alcohol store. Yeah, buyer beware, I think, is the first step. Yeah, or at least transparency for the buyer. Yeah. Oh, yeah, a reminder. Really great news. We are actually a Microsoft startup for Uniwise. So we're very excited about this because, as you imagine, we're gathering as much data as we can through COAs, and that's something that large companies are very much interested in. So we just found that out like 2 hours ago. That's why I didn't have it in the slides. But this is pretty exciting for us because it's the first cannabis technology, to my knowledge, that is a partner with Microsoft as a startup in a startup program with Microsoft. So thanks for reminding. Thank you very much. I appreciate you